Hello everyone, welcome back. I am Dr. Alexandra Mayer, women's hormone expert. In today's video, we're doing something a little different. I got asked a question in the comments on one of my YouTube videos that I think is a really good question for people, and I just want to go over my thoughts on it. So the question was all treatments that could help with estrogen-related perimenopausal depression. So this is a big mouthful, right? So there's a couple things to unpack in this. First of all, I want to just say thank you to the women who have been watching my videos this whole time. I really appreciate it. It is our goal to get more good information out there because really hormonal care sometimes can be a little bit iffy. And so I just want to get good information out there that hopefully helps people live their absolute best life for as long as humanly possible. And so if you like our videos, go ahead and hit like, hit the subscribe button, share it with a friend because that really helps us. So with this question, I'm going to make a couple assumptions that I'm just going to put out there right from the get-go, right? If I'm thinking perimenopausal depression, my guess is that this individual is probably experiencing some changes in her cycle, right? Where her cycle has either gotten shorter, longer, heavier, crazier, whatever that looks like, right? Some of those perimenopausal symptoms that's making her think that she is perimenopausal. She might even be without a period, right? Because the definition of menopause is 1 year without a period. So she could be 3 months, she could be 4 months, she could be 6 months, and she'd still be considered perimenopausal. So my guess is that she's probably experiencing some other symptoms that is making her think estrogen. Now, this could be a big assumption, right? Because sometimes when it comes to women's hormones, I think we're really uneducated, unfortunately, on what different hormones do and what their normal balance looks like and all of those things, right? But if we're specifically thinking estrogen, I think there are kind of treatment strategies that are available. Now, I will say, when it comes to perimenopausal depression, I think that this is a big deal. We know that rates of suicide and major mental health disorders really goes up in menopause, and we know that our hormone balance plays a big role. I think that estrogen is not the only player in this, right? I've mentioned a lot in previous videos that I see in perimenopausal women, their decline in testosterone come with a major rise in low mood or major rises in anxiety. And so I think that it really is about the balance of the hormones and looking at everything. One of my biggest pet peeves when patients walk into our office is when they only get a few, they either get the gamut run all at the wrong time, which is useless, or they get only a couple things run, which is also very confusing. And so you really want to be able to look at what the whole picture is, okay? But if we're specifically talking estrogen, HRT, hormone replacement therapy, is likely to be one of the best things to help with this. When it comes to women that have severe depression in menopause, we really want to think about how aggressively we want to treat that person because quality of life matters, right? And so I think that that is really important to consider. Obviously, every case is different. Obviously, when it comes down to it, there are family history and risk factors and things like that to consider. We have done previous videos on this channel about risk factors associated with estrogen, breast cancer risk, and all that stuff. We'll continue to talk about that because we've come a long way in medicine, a long way since the Women's Health Initiative, and we were giving women just a lot of false information on that. So I think in a lot of cases, kind of depending on family history and personal history, estrogen is a really safe treatment option that has lasting and profound effects, right? Because one of the things that I get asked a lot is what are some things that I can do to increase my estrogen in menopause? The answer is estrogen. That's it. Because at the end of the day, right, a lot of the other things that I'm going to go into, which I will go into next, are more symptom management than actually getting your hormones up. So let's say that that's not a good treatment option, right? Or let's say that you're already on estrogen and it's not enough. And so what are other treatment options? Conventionally, right, the treatment option is going to be an SSRI, so like an antidepressant, right? It's going to be the most common option. Sometimes in menopause, I do see a combo treatment of giving properly done hormone replacement therapy along with SSRIs to be a really important treatment strategy. Because at the end of the day, having severe depression is not the way that you want to live your life. But let's say that's not a good option. Let's say they don't work. Let's say they're not where we want to start. Then herbs can be a great option. So I like things like St. John's wort. If you're not already on SSRIs or antidepressant medications, then St. John's wort can be a great option. Herbs like Melissa. Melissa does have some, you don't want to do Melissa in super high doses if you have hypothyroidism, but Melissa is like a nice heart happy, healthy herb, and it's lemon balm. There are a lot of really great herbal blends that are meant for mood that can really help to take the edge off. And what I love about herbal medicine is that we can start to really dive into the picture, right? Because you might be like solely low mood, solely depression, in which case then we're going to hit those herbs really hard. You might have a mix of depression and anxiety where depression is the highest of those, but you still have both, right? You might have a mix of depression and anxiety where depression is the less and anxiety is more. And we can choose different herbs based on that, right? So if a patient has, for example, anxiety, passiflora is one of my favorite herbs for that. It's super indicated in women. It helps with that kind of mental calmness and mental chatter. And it really is just a great calming herb without the sedation. So herbal medicine can be awesome. Herbal medicine can also be awesome for symptom management associated with menopause. When I think about this, I think about hot flashes, night sweats, those kind of things. In terms of the mental component, I don't know that I've personally seen herbs be, like estrogenic herbs, be strong enough to help with that. It might be. It could be worth a try. It's worth a discussion with your doctor, right? I do see a lot of people prescribing herbs that don't know what the heck they're doing for females, and you really have to be careful, right? Like I've seen women who take maca that are way overdosed and it's way too strong for where they are in life, and that they're actually giving themselves some major symptoms. So you do have to be careful with herbs. They're stronger than we think, but they can be a really great way to mitigate some symptoms. Whether or not I think it's strong enough to get rid of severe perimenopausal depression, I think it could be worth a try. But I mean, oftentimes I think that estrogen might just be where we gotta go. What about other things? So I know that in the throes of depression, my next recommendations can be really challenging, right? Because at this end of the day, you're struggling, and I get that. But things like going out for a walk, things like exercising can be really, really important. Changing up your routine and exercise are some of the best antidepressants that we have. Right? Exercise is one of the best antidepressants that we have. And sometimes it's just getting into that routine. It's just kind of committing and saying, I'm going to do it. And so that can be a really good treatment option. And then some of the lifestyle stuff. So we know that alcohol intake, like if we have excessive alcohol intake, that can really change menopausal symptoms. We know that it makes vasomotor symptoms, so hot flashes and night sweats way worse. But alcohol intake can also really make mood worse. And it can lower our micronutrients and make things a little bit more challenging. So limiting alcohol intake and then getting your micronutrients in check. Sometimes this does mean running something like a micronutrient panel, which we've talked about in the past on this channel, because we know that, for example, methylation is really important to make serotonin, melatonin, and GABA. And serotonin is your happy hormone. And so we want to have the right B vitamins and activated vitamins on board to allow our body to do those things. So that would be what I would think about for this. Honestly, in somebody who's struggling with perimenopausal depression, I'd be having a really open conversation with your doctor about hormone replacement therapy, because they should be able to navigate that conversation and understand that this is not an uncommon symptom in menopause. So you're not alone. And then I wouldn't be scared to add co-treatment in if necessary, be that SSRIs or antidepressants or herbs. If you find somebody that's well versed in them, I think that's a great choice. And then things that you can do right now is get out into the sunshine, drink some water, and think about kind of some of those vitamins that might be necessary, like getting in just a really good activated multivitamin would be really, really helpful. And we do have videos in the past on this channel about choosing a multivitamin and seeing if it's activated. And so I really hope that helps answer your question. Again, perimenopausal depression is really no joke. A lot of the symptoms we get in menopause is really no joke, but being no joke does not mean that you have to live with it. And that's what I want patients to know from watching our channel. We'll see you next time for next time's video.